several years ago when I was an endourology fellow, I did a study where we used Medicare data to look at national adoption of HoLEP over time. So we looked at the years from 2008 to 2014. And what we found was that HoLEP was definitely increasing year to year as a BPH procedure, but the overall adoption of it still remained very low. So even in 2014, as a percentage of all BPH procedures that we measured, HoLEP only accounted for about 5% of those procedures. And the rationale for this study was that we've noticed, I do HoLEP and so do several of my partners, and we've noticed just a huge rise in interest in HoLEP and people doing HoLEP around the country over the last several years. And so we wanted to essentially repeat the study and update the data and see, what is happening now. We used a slightly different data set. So instead of using Medicare data, we used a larger data set using what's called the definitive healthcare claims data set, which includes not only Medicare, but also a lot of almost all private insured patients and even some VA patients in order to, really get a thorough look at HoLEP utilization across the United States. The key findings were that while on one hand, HoLEP utilization has definitely exploded, we found that in the time period we looked at between 2018 and 2022, there was a over 50% increase in HoLEP utilization. At the same time, that still represented an overall low number of BPH procedures. The number of BPH procedures has still remained really robust, and HoLEP in 2022 only represented about 6.7% of those total procedures. The other interesting trends that we noticed were, number one, that the number of surgeons that are actually doing any HoLEP increased by about 30%. We found that the number of surgeons who were doing at least 10 HoLEPs a year, what we call active HoLEP surgeons, increased about 43%. And the number of surgeons who we consider high volume HoLEP surgeons doing more than 50 HoLEPs a year also significantly increased and represented the majority of HoLEPs that were being done in the US. And so I think those trends overall show that people are not only just trying HoLEP, but they're sticking with it. And people are not only sticking with it, becoming high volume surgeons, and those high volume surgeons are capturing a large amount of the volume. We wanted to look also at geographic trends. It's something that we looked at in the prior paper that we wanted to update to see where are HoLEPs being done in the US. We looked at specifically what we call active HoLEP surgeons, people doing at least 10 cases a year. And we found that significant geographic disparities, unfortunately, still remain. So the number of states that have at least one active HoLEP surgeon did increase from our prior paper, but it only increased from 32 to 35 states that had a HoLEP surgeon. And so that still, unfortunately, leaves about 31% of states that don't have a single active HoLEP surgeon. And interestingly, the regions that you would think would have very, good, robust numbers of HoLEP providers don't. So the Northeast, for example, historically in the old paper was the most underserved region, had the lowest concentration of HoLEP surgeons to patients. And in our updated numbers, the numbers improved, the ratio improved, but they still remain the most underserved region with the worst ratio of HoLEP providers to number of patients, while the South remained the best region, the best ratio in the old paper, as well as in the updated numbers.